See is a case of operated keloid right earlobe, and she came after 30 days, and I have noticed that there is little hypertrophy here, little recurrence of the keloid. So here in this patient, I will give intra-lesional 5-FU tricot solution, triamcinalone solution, and every injection in keloid is painful. That's why I am going to give earlobe block before giving the intrakeloidal injection. Beta एक छोटी चीटी काटेगी है. So I have taken 30 gauge needle and I will block this area by about half ml of the anesthetic solution. See, so at the angle or at the junction of earlobe to the cheek, I just infiltrate by half ml of the solution here. Alright, so only half ml of the solution. This will block the lower 2/3 of the pinna. This blocks the great auricular nerve. Now nearly half ml I have injected and wait for 5 minutes. Now there is a small keloid on the back side also. Just at its attachment to the cheek, insert 30 gauge needle and then inject the solution. Block the earlobe, the post-auricular nerve. This anesthetize the nearly 2/3 of the pinna. Just wait for 5 minutes. ये बेटे कुछ भारी हो रहा है ये वाला? हाँ, हाँ, यहाँ भारी है या ये भारी है बेटे? Yes, okay. She says that this is numb, not the upper part, because the upper part is supplied by the auriculotemporal nerve, lower 2/3 supplied by this great auricular nerve, auriculotemporal nerve, sorry, great auricular nerve, and this part supplied by the auriculotemporal nerve. This part is supplied by the auricular branch of the vagus nerve. So our concern is to numb this area, and this is effective after giving the earlobe block. Now I have taken the solution that contains the triamcinalone and is also contain 5-FU. So now this needle is 26 gauge needle. Just palpate it. This is longitudinal placed keloid. So from this side, don't select the normal healthy tissue. From this side, insert the needle, and this should be painless because this child is 14 years or 15 years old. So now I am feeling some hard tissue. This is the keloid. Just insert gently in a deeper plane rather than a superficial plane, and then inject the solution. Right, and see the blanching also. The color changes there. So this indicates the proper placement of this solution. If you inject too superficial, because of 5-FU, there will be formation of ulcer, and that is really recalcitrant to heal. So this is the technique I am following to give the painless intra-lesional injection in the ear or pinna. See, now this blanching is there. Now I will repeat the operation on this side, but the keloid is very small, say about 4 to 5 millimeter. See, the nodule is there. It is there. So now this, I have already given one injection about 3 weeks prior. So now from here, so I will inject to melt this keloid on this area. So now destabilize it, then inject it. You can feel some hard tissue, and now here inject the solution. Don't injure your finger while injection. So this is again painless because I have blocked the earlobe by giving half ml of the anesthetic solution. Now this is all. See, you can just get blanched. So don't over inject this solution, just, and this is enough. So this earlobe block performed successfully, and the injection was also done successfully and without any pain.